It is Sunday, May 9th, and I just received a patient from the PACU who had a laparoscopic cholecystectomy. Hello, Ms. Smith. My name is Mike. I'm going to be your nurse today. I just need to ask you a few questions and perform an assessment to better plan your care. At any time, feel free to express any concerns or questions. Does that sound all right?
Perfect.
Excellent. I'm going to perform hand hygiene, provide privacy. Prior to this assessment, I already did the patient's vitals. Everything was within normal limits. And upon entering the room, I did my 60-second assessment, assessing the patient's appearance, their ABCs, and their demeanor, along with the patient's their safety, making sure the environment is free of clutter, the bed's in the lowest position, bed alarm is on, and there's proper lighting. I was also checking to see, checking for emergency equipment, that there's an ambu bag, suction, and oxygen. And finally, any equipment that's in use, making sure it's functioning properly, and any tubes going to the patient are connected properly, and there's no kinks or twists. So I need to check your bracelet real quick. You tell me your name and date of birth.
Jan Smith, August 8/4/76.
Excellent. And can you tell me today's date?
May 9th, 2021.
And what is this building we're in?
Hospital.
And what brought you in today?
I had my gallbladder removed.
Excellent. You're alert and oriented ×4. I'm going to lower your bed here so I can assess your abdomen. So just lay flat. Perfect. So I lower the bed. How are you feeling? Have you had any abdominal pain? Any nausea or vomiting?
No.
How about, how's your appetite? You feeling hungry?
I'm not hungry yet.
Have you passed any gas yet, or do you feel like you need to have a bowel movement?
I do not.
Not yet. Okay, good. So, assessing the incision sites. Incision sites look great. There's no redness or swelling, no signs of infection. Well, there's a little bit of redness, but no signs of infection. Checking the contour of the abdomen. Abdomen appears symmetrical with no signs of peristalsis. I'm going to listen to your abdomen, starting at the right lower quadrant. And I'll listen for 5 to 7 gurgles or clicks. I'm listening for 15 seconds in each quadrant. If I don't hear 5 to 7 gurgles or clicks, I'll listen for a full 2 minutes. When I'm hearing gurgles and clicks, so you'll probably be passing gas pretty soon. I'm going to feel your abdomen now. Let me know if you feel any pain, okay? So I'm being careful not to touch the incision sites, and I'm watching the patient, seeing for any visual signs of pain. Okay, excellent. I'm going to raise the head of your bed back up again.
Okay.
And I'm going to assess your legs. Have you had any pain, numbness, tingling?
None.
How about stiff joints?
None.
Skin is warm, dry, and no signs of lesions. Dorsalis pedis and posterior tibial pulses are strong, +3. Capillary refill is under 3 seconds. No signs of swelling. You flex your foot for me and push down. Push up on my hands. Push down. Excellent. You flex your knees. Good. You push up on my hands. Push down on my hands. Excellent. I'm going to assess your arms. Palms up for me. Have you had any pain, numbness, or tingling?
None.
Skin, or how about stiff joints?
None.
Skin is warm, dry, no signs of lesions. Radial pulse is strong, +3. Capillary refill is under 3 seconds. Can you flex your arm for me? Push it down, push up on my arm, and push down on my arms. Excellent. No signs of swelling?
No.
Next, I'm going to listen to your heart. Have you had any chest pain, palpitations, lightheadedness, dizziness?
None.
Good. I'm going to listen to your heart, starting at the aortic valve, which is second intercostal space, right side of the sternal line. And then over to the pulmonic valve, which is second intercostal space, left sternal side, down to Erb's point, which is third intercostal space, left sternal side, down to the tricuspid valve, which is the fourth intercostal space, left sternal side, and finally down to the mitral valve, which is the fifth intercostal space, mid-clavicular line. And here I'll listen for a full minute. Excellent. You have a regular rhythm with S1 and S2 sounds, no S3 or S4 sounds or heart murmurs. Next, I'm going to listen to your lungs. Have you had any difficulty breathing? How about on exertion?
None.
Any cough or sputum?
None.
Skin is warm, dry, no signs of lesions. Anterior chest movement is symmetrical. I will start with the right upper area, which is second intercostal space, mid-clavicular line. I want you to just breathe deeply through your mouth. And then over to the left upper area, which is second intercostal space, mid-clavicular line. Down to the left middle space, which is fourth intercostal space, mid-clavicular line. Over to the right middle space, which is fourth intercostal space, mid-clavicular line. Down to the right lower area, which is half upper arm, anterior axillary line. Over to the left lower area, which is half upper arm, anterior axillary line. Excellent. Now I'm going to listen to the back of your lungs. I would just have you roll over, but for the camera, patient that just had a cholecystectomy would not be able to do this. So I can assess the patient's back here while I'm here. Skin is warm, dry, no signs of lesions. No signs of pressure ulcers at the bony prominences at the hips, coccyx, shoulder blades, and shoulders. or posterior chest movement is symmetrical. I will start the left lower area, which is half upper arm, posterior axillary line. Just take deep breaths through your mouth. Still staying on the left side, half upper arm, left sternal column side, not sternal, spinal column side. Just take deep breaths through your mouth. Over to the right lower area, half upper arm, right spinal column side. Still staying on the right lower area, mid upper arm, posterior axillary line. Up to the right middle area, which is next to the right mid-scapular side. Over to the left middle area, which is at the left mid-scapular side. Up to the left upper area, which is left upper scapular side. Over to the right upper area, which is the right upper scapular side. Okay, excellent. You can roll back over. Your respirations are clear with no signs of wheezes, crackles, stridor, or friction work. Now I'm going to assess your head and neck. Have you had any headaches, blurred vision, pain or ringing in your ears, changes in vision, smell, taste, or hearing?
None.
Excellent. Hair is consistent throughout and evenly distributed. Color appears to be healthy. Skin is warm and dry with no signs of lesions, no signs of JVD or tracheal deviation. When I already assessed the mouth when I took the temperature for changes in color, lack of moisture, and teeth and gum quality. Will you smile for me, frown for me, and stick out your tongue? Face is symmetrical. Now I'm going to assess your eyes. You look forward for me. Pupils are even and round, 4 millimeters. I'm going to shine a light. So first time I'm looking for a direct response. Second time I'm looking for a consensual response. Just keep looking forward. Again, looking for direct response and then consensual response. I'll look at the pen and focus on the wall behind it, and then back at the pen. That's accommodation. And now I'm assessing convergence. Follow the pen towards and away. Good. Do you have any family or friends coming to visit you today?
I do.
Who's coming to visit you?
My partner.
Excellent. Do you live with your partner?
I do.
Great. It's good to have good support here and at home.
It is.
Great. Well, that will conclude your assessment. Thank you very much. I will be back in a few hours with your medication. So I perform hand hygiene, open the slot, open the privacy, and document.